Lotus pose, Padmasana. The lotus pose requires very high mobility in the hip joints. Exercisers with a suitable natural body structure and especially high flexibility can perform this pose with relative ease, but for most people, their hip joint structure does not allow full rotational range for the thigh bone and a blockage is created. Exercising improperly or too aggressively may cause serious damage to the knees. We will show this clearly in our kinesiological analysis of the position. The hip internal rotators and the piriformis are stretched with the lateral rotation and flexion of the thigh. The piriformis contracts and laterally rotates the femur in an anatomical position. Once the thigh is flexed and laterally rotated, the piriformis is being stretched. Lotus pose, limited range of motion in external hip rotation. Under normal conditions, the position of the lower limb joints during the lotus pose is a combination of hip flexion with external rotation and horizontal abduction. Kinesiologically, the normal range of hip rotation is 60 degrees. When sitting in the lotus position, the range required for external hip rotation is much greater, and in order to perform the position correctly, a range of 100 to 120 degrees is needed. Exercisers whose body structure is naturally suitable and especially flexible can do this with relative ease. But for most people, the hip joint structure does not allow the thigh bone the full range of rotation, and a block is created in the middle of the movement, past which the head of the femur can no longer continue to rotate outwardly. When the thigh bone ceases to rotate, the only way to raise the foot is to create strong knee rotation. Anatomically, the knees are not built for this movement. The normative range of external knee rotation is only 40 degrees. If the exerciser continues to pull the foot upward after the hip joint has stopped external rotation, or if the student or teacher gives the knee a strong downward push, the tibia, shin bone, and femur, thigh bone, will act like two levers that exert tremendous force on the knee. Like two long screws, they will pinch the medial meniscus of the knee. Even at low intensity, this action may seriously harm the meniscus. It also causes excessive stress on the lateral ligaments. What's the solution? A. Never force or pressure the learner into the lotus or similar positions, and do not encourage learners who force themselves. Teach the learners not to work with force and to respond to pain, especially pain in the knees. Do not improve the position by pulling the foot or ankle, and do not push the knee downward. In any instance of pain in the knee, do not perform the position at all. B. Gradual drill in which we begin with positions that require less external rotation of the pelvis, such as half lotus, in other words, with only one leg and not crossing the second leg. C. Emphases for a preparatory exercise. As preparation for performing the position, it is important to include flexibility exercise aimed at releasing tension points in the hip joint, mainly in the horizontal plane in rotational movements. Factors associated with hip joint rotation. When sitting in the lotus position, several factors may restrict range of movement in the hip joint. The most restricting factors are 1. Structural factors, 2. functional shortening of the internal rotators. Structural factors. Changes in the torsion angle of the femur. Normative state is 12 degrees. The internal rotators. Structural factors. Changes in the torsion angle of the femur. If the limitation is only structural, any attempt to force the legs to be lower during sitting may cause damage to the knee joints. You can't change the structure of the femur. Restricting factor number 2, functional shortening of the internal rotators. Shortening or tightening of the internal rotators will restrict lateral rotation at the hip joint. What should we do? Preparatory exercise for increasing flexibility of the hip joint.
Possible causes for restriction in lateral rotation. Part A. Anatomical structure of the femur. One of the causes for restrictions in movement of the thigh is related to the anatomical structure of the femur. One of the factors that affect rotation movements is the torsion angle of the femur. Here is the femoral neck and the femoral condyles. The torsion angle is created between the connection of the longitudinal line of the femoral neck and the line connecting the two femoral condyles. Under normal conditions, the torsion angle is 12 degrees. This angle enables the flexion movement of the thigh to be smoothly integrated with the rotation movements. Sometimes a structural problem is created that is expressed in a smaller or larger than normal angle. Changes in the torsion angle may create postural problems in the lower limbs. An increased angle, more than 12 degrees, will be expressed in a toe in position, anteversion. A smaller than normal angle, less than 12 degrees, will cause a toe out position, retroversion. On the left, it's retroversion, and on the right, it's anteversion. People with anteversion will find it very difficult to sit in positions that create lateral rotation in the hip. In this case, the cause for this is structural, and any attempt to force the legs to be lower during sitting may cause damage to the knee joints. The body takes the movement to the place where it is comfortable, and this will be expressed in increased rotation of the knees. Possible causes for restriction in lateral rotation. Part B. Lack of muscular balance. A possible cause for restriction in lateral rotation is a lack of balance between the muscles that perform inward or outward rotation in the hip joint. In the horizontal plane, a functional balance between the groups of muscles that rotate the thigh inwards and outwards is especially important. The muscles that perform lateral rotation of the hip are the obturator externus, the obturator internus, the iliopsoas, and the hip adductors. Adductors from a posterior view. Adduct and rotate the hip. Sartorius, piriformis, gluteus medius. Opposite muscles that perform medial rotation of the hip pectinus. Gluteus minimus, anterior fibers. Gluteus medius, anterior fibers. Adductor magnus, vertical head. Shortness of the internal rotators muscle will create a restriction in cross-leg sitting. Contraction of the gluteus medius muscle. The solution? Flexibility exercises for these muscles in preparation for performing sitting positions.